Hello guys, so now we shall be discussing regarding the ureters. Okay, so how many ureters do we have? We basically have got two important ureters on either side. Okay, so we are discussing about ureters. Right, if you look at the ureters over here, let us say that this is the kidney, right, and this is the kidney, the right kidney as well as the left kidney. Now coming out of from the hilum of the right and left kidney, you have got this particular structure that is coming out. This particular structure over here is called as your ureters. Okay. Now these ureters, what is going to happen is that these ureters they open up into your urinary bladder, and this is the urethra. Okay. So what is the function of the ureters? They are the collecting ducts, right? They are the collecting tubes or the communication between the kidneys as well as the urinary bladder. So they are the passageways of the urine which has to pass out of your urinary bladder, right? So these are called as your ureters. Now, if you look at the ureters, there are some constrictions that are located within the ureters. So how many constrictions are there? There are basically three important constrictions within the ureters. So you have to know what are these constrictions. So these constrictions are called as ureteric constrictions. These constrictions are called as ureteric constrictions. So for example, if you look at these ureteric constrictions, this is your right kidney and right ureter. Okay, and this is opening into what? It is opening into your urinary bladder. And this is your urethra. Okay, so I haven't drawn the constrictions over here, but I'm going to tell you what are the constrictions we have got. So this particular constriction, this is called as constriction number 1. So this constriction, there is a constriction over here, and by the way, this junction over here is called as pelvic-ureteric junction. Now all of you know that we have got hilum, right, within the kidney. If this is a kidney and if this is the ureter over here, you see this wide part, whatever you can see here, this is called as a hilum. So 5 centimeters away from the 5 centimeters away from the hilum, you have got a junction called as pelvic-ureteric junction. So that is the place for the first constriction. So the first constriction is pelvic-ureteric junction. So where is this pelvic-ureteric junction located? Pelvic-ureteric junction is located 5 centimeters away from the hilum. So 5 centimeters away from the hilum, you have got pelvic-ureteric junction. The second important thing is that, second important constriction is that here you have got an artery like this. Okay, actually you know this is your abdominal aorta. Abdominal aorta is dividing into two common iliac arteries, right? One is called as a right common iliac, another one is called as a left common iliac. So exactly this point, right, this is called as a second constriction. So where is this constriction happening? This constriction is happening at the pelvic brim. Where is it? It is happening at the pelvic brim, right? So where is exactly at this level of pelvic brim? What is the structure that is crossing? That is the common iliac artery. So this pelvic brim is crossed by common iliac artery. Next, where is the third constriction? Third constriction is this one, the place where the ureter enters into your urinary bladder. Okay, so this is called as the entry point, right? So where the ureter enters the bladder, so that is the third constriction we have got. So this junction where it is entering into the bladder, right, is called as ureterovesicular junction. Okay, why vesicular? Urinary bladder is called as vesica. So the junction is ureterovesicular junction. So there are three important constrictions over here. One constriction is called as a pelvic-ureteric constriction. Second one is at the level of pelvic brim, and third one is called as the ureterovesicular junction. Okay, these are the three important constrictions which you can see over here. Now let us discuss about the relations. So what are the relations of the ureters we have got? So when it comes to the relations, we will discuss two types of relations. First we will discuss is the anterior relation. Anterior relations of the ureter. And after that we will discuss is the posterior relations of the ureter. So regarding the anterior relations also, first we will discuss the anterior relations of the right ureter. So this is called as your right ureter, and later we will discuss the anterior relations of the left ureter. Now if you look at this picture over here, there is one more important structure which you need to know. So this is that particular structure. You see what is this structure over here? So this structure is called as the second part of your duodenum. So second part of duodenum is present. Where it is present? It is present anterior. Okay. The second part of the duodenum is present anterior. Okay, let me draw it like this. So this is clear, I think. The second part of the duodenum is present anterior to your what? To your which ureter? Right ureter. So we are discussing about the right ureter. So regarding this right ureter, what is the important thing you need to know? That the second part, the first important thing is the second part of duodenum. Second part of the duodenum. Now after the second part of the duodenum is done, you have got an artery that is passing like this. Okay. You have got an artery that is passing in front of this, and in the same way you have got a vein that is passing in front of this. So this artery and vein, these structures are called as gonadal vessels. So gonadal vessels in the sense gonadal artery as well as gonadal vein. Next, third important thing is that here you have got an artery called as superior mesenteric artery. This superior mesenteric artery gives out branches. For example, let us say here this is called as ascending colon. Okay, ascending colon is also called as the right part of the colon because it is present on the right side. So this superior mesenteric artery, this artery is superior mesenteric artery. So this superior mesenteric artery, what it is doing? It is giving a branch to the right side of the colon. That is why this branch is called as a right colic artery. Okay, and next it gives a branch down here. This is called as a iliocolic artery. So there are two branches, A as well as B. So what is A? A is your right colic artery and B is your iliocolic artery. So two arteries, right colic artery as well as the iliocolic artery. And final last important thing over here you have got is this part over here is called as your root of your mesentery. So this is called as your root of mesentery. So what are the structures that you basically see over here? The structures which you basically see over here are the first important structure over here, if you see, right? The first important structure is the second part of the duodenum. After this second part of the duodenum, you have got your gonadal vessels like that is gonadal artery as well as gonadal vein. Next you have got what? You have got a right colic artery as well as iliocolic artery, right? So they are the branches of the superior mesenteric artery. Next, obviously the last part you have got is the root of the mesentery. So these are the four important structures that are forming the anterior, that are related to the anterior side of the ureter. So they are called as the anterior relations. Now if you look at the same anterior relations of the left side of the kidney, okay, for example this is your left kidney, okay, so this is your left kidney. So this left kidney has got ureter like this, right? So this ureter over here is called as what? This is your left ureter. Okay, so what are the relations of the left ureter? On the left ureter also you have got an artery like this, you have got a vein like this. So these two structures over here are called as what? Gonadal vessels. So these are also called as gonadal vessels. Okay, now after this gonadal vessels, the next important thing you need to know. What is the next important thing you need to know? That for example, let us say here I am drawing the right ureter like this. Okay, now important thing is that the colon which you have over here is called as your ascending colon. The colon which you have over here is called as your transverse colon. In the same way, the colon which you have over here is called as your descending colon. So ascending colon is going up like this, right? Descending colon is going down like this. Where is your ascending colon present? Present on the right side. Where is your descending colon present? It is present on the left side over here. It is present on the left side. So, what I am telling you is that there is an other artery. Previously, the artery was superior mesenteric artery. Now, the artery over here was inferior mesenteric artery. See, this artery over here is inferior mesenteric artery. This inferior mesenteric artery gives out two branches. What are those two branches? One branch supplies to your descending colon. Okay, that is called as left colic artery. What is that artery called? I will write it in a minute. Left colic artery. Next, after that, this descending colon finally continues as sigmoid colon, and then you got your rectum as well as your anus. So, another branch that gives supply to the sigmoid colon is called as sigmoid artery. So, what is the artery A, B and C? What is the artery A over here? A stands for what? Inferior mesenteric artery. A is, what is that? A is inferior mesenteric artery. Now, this inferior mesenteric artery is having two branches. One is called as B, another one is called as C. B is called as your left colic artery and C is called as your sigmoid artery. Sigmoid artery. So, these are the structures that are forming the anterior relations, right? So, overall you know the anterior relations on the right side now, right? The anterior relations of the left side, right? So, anterior relations of the right ureter, anterior relations of the left ureter. The anterior relations of the right ureter, one is this one, second part of the duodenum, gonadal vessels, third one is superior mesenteric artery branches, fourth one is the root of the mesentery. The left side is, the first one is your gonadal vessels, the second one is your inferior mesenteric artery and its two branches. Okay, so this is one of the important. Now, after the anterior relation, now let us discuss about the posterior relation. Posterior relation of the ureter, posterior relations of the ureter are common both for the right ureter as well as the left ureter. What are these posterior relations? One you have is called as a psoas major muscle. All of you know psoas major muscle, right? So, one muscle you have is a psoas major muscle and second one is a bifurcation of the common iliac. All of you know that this is called as your aorta. This is called as your aorta. Aorta is divided into two branches. These are called as two common iliacs. Again, common iliac is again divided into two. One is called external iliac and internal iliac. So, that is what is telling there is bifurcation of common iliac. Bifurcation of common iliac artery. Okay, so these two form the posterior relations. Now, if we look, what is the blood supply of the ureter? What is the artery that is supplying? If you look at the blood supply of your ureter, so can anyone guess what kind of arteries are supplied to the ureter? The first important thing that you need to know over here is that, let us say this is your kidney, okay, and let us say this is your ureter over here, okay. Now, let us also tell that this is your aorta. Your aorta is divided into two common iliacs, you know that. So, these are called as common iliac arteries. Common iliac arteries, and this is your abdominal aorta. Abdominal aorta dividing into two common iliac arteries. Now, there is a branch that is coming and supplying to the ureter here. This branch is called as your renal artery. This branch is your renal artery. After that, there is a direct branch of abdominal aorta supplying to the ureters. This is called as gonadal artery. Okay. And next, one branch from the abdominal aorta directly supplies. This is called as a direct branch of abdominal aorta. What is this called? This is called as a direct branch of abdominal aorta. Direct branch of your abdominal aorta. Right? So, these are some of the very important branches. After that, these common iliacs divide into two more branches I told you. What are these two branches? This is called as external iliac and this is called as internal iliac. One is external iliac, another one is internal iliac. This internal iliac gives branches like this to the ureter, to the complete distal end of the ureter. What are these two branches which are given? See, this branch over here is called as superior vesicular artery, okay, and below that another artery is called as inferior vesicular artery, superior vesicular artery, another one is your inferior vesicular artery. So these are the two branches. So this is all you need to know regarding the ureters, guys. So thank you so much for watching my video. Goodbye.